Good evening, everyone. You are welcome to another edition of Data Chart. And on this edition of Data Chart, we're going to be analyzing, interrogating, and interpreting polls and survey findings to help policymakers and you make sense of the numbers. I don't know. For those of you who don't know, Data Chart is actually a production of NOIPolls Limited. And like I said, we're going to be having a very serious conversation today, and it borders on everyone. It's something that is quite topical, and everybody seems to be involved in this very critical issue. I am Nelly Oguchi, Head Corporate Communications, NOIPolls. I'll be right back right after the short break, and we'll go right into the conversation. You're welcome again. It is still Data Chat on Ray Power 100.5 FM Abuja. All right, like I said, we are going to have a very serious conversation this evening, and I want everyone to get involved. I'm hoping to open the phone lines very early today so we all get involved in this very, very critical conversation. The youthful population of Nigerians between ages 15 and ages 35 make for about 16.8% of the population. And this is about, say, 33.6 million, Nigerians. According to the recently conducted drug and substance abuse poll result by NOIPolls, 92%, I want us to take note of all of the figures. 92% of Nigerians opine that drug and substance abuse is prevalent in Nigeria, and it's most prevalent amongst young people. 92%. I mean, the figure is alarming and calls for concern for all well-meaning Nigerians. The implication of this is that our children and our wards are not safe. It means that the chances of your children, the chances of your ward, your younger ones, getting involved with illicit drugs is over 90%. This is alarming. This is also considering the rippling effect of substance abuse on the victim's health and life generally. So I want you to stop. Stop. Just pause a minute to think of it. 92%. The numbers mean that your daughter, your son, your loved one, might just be hooked on drugs and you may not know. 92%. This is actually very, very scary. It means that 9 out of 10 Nigerians, probably 9 out of 10 young people use drugs, abuse drugs. So to this end, we're going to be analyzing the implication of drug abuse today. So we're looking at the drug abuse poll findings with regards the social impact of substance abuse on our youthful population and interventions to help deal with the issue. So basically, we're looking at drug and substance abuse today. Well, right, just before we go into that conversation full time, we'll have the team lead of the polling unit of NOIPolls, Chidi Akugwe. He will take us through the findings of the poll, just very briefly, and we'll go through the findings of the poll, see what the poll findings are saying, and then we'll come back to this conversation.
The poll was conducted to commemorate the International Day Against Drug Abuse and Illicit Trafficking. It was on the 26th of June. We conducted this poll to follow up on the polls that we've conducted in a series of drug abuse polls that we've conducted on this particular topic. And this particular poll, this new poll, revealed that a lot of people, 92% to be specific, of adult Nigerians nationwide believe that drug and substance abuse is very prevalent in the country. To just run through the key highlights of the poll gathered that teenagers between the age of 15 to 29 years old According to the Nigerians, adult Nigerians who we spoke with, about 88% of them indicated that the drug abuse and substance abuse is more prevalent with teenagers between the ages of 15 and young adults. And of course, we could all remember on 26th of June last year, where Buba Marwa, who is the chairman of the National Drug Law Enforcement Agent, how he lamented over the pervasive abuse of substance in the country. He also mentioned that about 10.6 million Nigerians are actively abusing substance, as in their cannabis, different sorts of cannabis in the country. When you go down to the findings, you also see that about 41% cited most abused illicit drug in the country is marijuana. Marijuana, I think when we talk about weed, Igbo, and all other substance, which are all grouped into marijuana. So 41% specifically cited that marijuana is the most abused drug. These are followed by those who mentioned codeine and alcohol. 22% mentioned codeine, while 17% mentioned alcohol. If you could recall, when this poll was conducted in 2018, there was a BBC documentary that revealed a lot of things about this specific drug, codeine, and it was banned in the country. We also asked respondents about the causes of substance abuse, and 33% revealed that it is peer pressure. Another 33% stated that it is unemployment. 26% mentioned that it's due to parental neglect. Poverty was mentioned at 17%, illiteracy 13%, and then frustration 13%, and other reasons that were given. Things like self-pressure, availability, and affordability in terms of how affordable those drugs are. For instance, codeine. Anybody could afford to buy codeine and all that. Then we also asked a question about family member. The question goes specifically, do you have any family member involved in any of the following drug abuse? Alcohol. 16% say they had a family member who has been involved in abuse, and one of those is alcohol. 16% mentioned that. Smoking marijuana, 15% mentioned that. Tobacco, 15%. Prescription drug, 11%. Then taking codeine, 8%. Even after it has been banned, the importation has been banned in Nigeria, we still have 8% of Nigerians mentioning that they have a family member who abused codeine. 66% of the respondents mentioned hard drug. In terms of curbing these incidents, Nigerians were particular about creating jobs, given that they feel that idleness could lead to some of this. 41% mentioned creating jobs, while 30% mentioned creating awareness on the effect of drug and substance abuse. 19% felt that there should be a ban on sale of illicit drug. Another 19% mentioned that they should enact and enforce strict regulation that has to do with drug and substance abuse in the country. Then 16% mentioned that government should improve the economy. They might have felt that the economic hardship could also lead people in terms, like those people who mentioned frustration. Frustration could have led someone to be engaged in drug and substance abuse. So these are the key highlights.
All right, that was team lead of the polling unit of NOIPolls, Chidi Akubwe. He took us through the recently released drug abuse poll. For full report of that poll, you and other polls, you can check it out on www.noi-polls.com. www.noi-polls.com. You'll see the full report of that poll. You'll also see a lot of other topical socioeconomic polls cutting across critical sectors. So now we go into the conversation proper. So with me to unbundle the statistics, we have Dr. Hope Omeza. He's a medical doctor with several professional certifications in addiction treatment. He's also president, Vanguard Against Drug Abuse. I think it's VGADA. Okay, he's also the CEO of VGADA Detox Center,
a drug addiction treatment center in Abuja with a 120-bed space capacity. I like this. I really like this. I really didn't know we had anything like this in Abuja, so I'm very particular about this. We're going to be looking at the social impact of substance abuse on our youthful population and the interventions to help deal with this issue. Like I said earlier, we have about 33.6 million youths in Nigeria. That is quite an alarming number. And the poll findings are saying about 92% of Nigerians use or abuse drug. Scary figures we have. So we're going to go into this conversation, and so we're going to throw it open. Like I said, I'm going to open the phone lines early enough because I'd like to hear what you'd have to say. But just before that, let's even look at what the polls are saying. The findings have shown that 92% of Nigerians are of the opinion that drug and substance abuse is prevalent in Nigeria. Across the geopolitical zones, the prevalent rate seems high. So I'm wondering, if we look at this, somebody listening from out would say, how can you say 92%? So, Dr. Ameza, I need you to, you do a lot in terms of advocacy for drug abuse. Could these numbers be a true reflection of the substance abuse rate in Nigeria? Have we inflated it? Does it look anything like what the poll findings are saying?
Yeah, thank you very much for having me on this program. I think that we do have much more than the statistics are giving us. But if I understand the poll result, it is saying that in the opinion of Nigerians, about 71% of adult Nigerians are saying drug abuse is very prevalent, and 21% of adult Nigerians are saying that it is somewhat prevalent, and that makes up the 92%.
Aggregated.
Yeah, so going back to the 2018 drug use survey, which is the last survey done in Nigeria as regards drug and substance use, we have at least 14.3 million Nigerians who had used drug in the last year. Remember, this research was carried out in 2017 and was released in 2018. Of course, you don't expect the numbers to be the same by today. So indeed, for those other percentage of Nigerians who feel that it may not be prevalent, I think that they probably are not aware of their environment, or they are not in the know of the circumstances that are bedeviling us today socially. Because drug abuse is in the background of most of our social vices. Not only are they enhancers, but you see, they kind of propel. In fact, recently we hear that bandits request for drugs as exchange.
Oh, wow.
As ransom rather, for their victims. So that says that, we are in for a big deal if we don't take all available measures in addressing this menace.
All right, so if we look at the reports again, it says that the most abused substance in Nigeria are marijuana. 41% of the respondents say marijuana is the most abused. 22% say codeine. Alcohol and prescription drugs are at 17% and 16% respectively. So I want us to look at this. When we even say prescription drug, one begins to wonder what exactly prescription drugs are. But I want you to talk about what prescription drugs are, but I also want you to look into the problems. What are the problems associated with substance abuse and the effect of these substances on the human body and the human mind in terms of mental health?
In terms of the percentage of this drug use from one to the other, marijuana is on top of this list. And from the last survey, which we still quote from, is 10.6 million Nigerians.
What are the street names for that?
Many, depend on the locality. It can be called pot, Igbo, weed. They have many names for it. Okay, so, and then of course, because we have a very wide range of audience, perhaps listening to us now, it may not be good to mention some other names so as not to incite curiosity. Yeah, so marijuana is on the list, it's on top of that list. 10.6 million out of the 14.3 million Nigerians who were who used drug in the last year in 2018. So if 10.6 out of the 14.3, now codeine comes second to these, and then you have your tramadol and other prescription drugs, as you rightly said. Now for prescription drugs, what it simply means is drugs that medical professionals or practitioners will pick up their pen and write for a patient or for someone in need of care. Now, these drugs can be tramadol. An example of that is tramadol, even the codeine. Okay, you have the benzodiazepines. Okay, and of course a range of other drugs that can be prescribed by doctors and other medical professionals, unfortunately. Okay, because ideally you shouldn't have a non-medical doctor making such kind of prescription. Okay, but today you have many doctors, who will pick up their pen and make prescriptions. Even when a medical doctor is making prescriptions, I remember then in medical school we are advised to be very careful in prescribing drugs that have high propensity of causing addiction to the individuals. All right. So now I remember in 2019 we're making a proposal to the National Assembly, then the Committee on Narcotics, and we said that it is important that a bill be sponsored where we look at what we call a triplicate prescription pattern, which is in practice in the UK, where a medical professional prescribing tramadol and other prescription drugs write this particular prescription on 3 notepads, prescription pads. Now, this 3 prescription pad goes with the patient, 1 stays with the hospital rather, 2 goes with the patient. Now the patient takes it to the pharmacist. In Abuja today, as the best I know is that if you are not a pharmacist, you don't have the right to run a pharmaceutical store. All right, so a pharmacy store. So these 2 prescription pad, 3, 2 rather, goes with the patient to the pharmacist. The pharmacist takes these 2 pads from the patient, keeps 1 with him, and send 1 to the state designated agency, okay, for record purpose. Now, as a medical doctor who has the biro right, okay, to prescribe these drugs, you are going to be careful, knowing that these prescription pads are not just ending with the patient or with me. So the patient himself or herself is also going to be careful, knowing that I am on record. This is being practiced in the UK. So for these controlled drugs, and we have 5 classes of controlled drugs, controlled drug class 1, 2, 3, 4, 5. And the various prescription drugs, fall into these classes. So whichever of the drugs you're prescribing, it goes on this pattern of prescription. So that is one way to go about it. And then we have patients too who do what we call doctor shopping. He or she comes to you today, to this particular doctor, gets a prescription of mentazocine, and then goes to another doctor tomorrow because this will not prescribe this will not prescribe same drug for him tomorrow. So you will go to another person tomorrow. So, but if he or she knows that this is being documented, it has an organized system where it can be tracked. So you see a particular hospital number or a particular patient's name, frequenting the system, then there are red flags and you say, who is this person? Okay, because again, you have to assist our people. You see, for some reasons, it's not completely their fault, to be fair to them. For somebody now who has sickle cell anemia, who is always in painful crisis, I have many of them. Some are even medical professionals who are sickle cell anemia patients and are addicted to some of these prescription drugs. Okay, so we must be able to set up systems that assist them, okay, to deter from this practice.
All right, still on the findings, the drug and substance abuse, is most prevalent amongst young people, mostly people between ages 19 and 29. From our poll findings, we are saying that people between 19 and 29 years make for about 48% of people who abuse these drugs. Then those from between 15 to 18% makes for about 40%. This makes for about aggregated, it makes for about 98% of young people within these age brackets, that is within ages 15 to 29. This is very scary. I'm saying this, this is very scary because it means that our teenagers who are probably in secondary school, who are probably just getting admission into the university, up until they probably get to youth service and get into the labor market. So we're looking at between ages 15 and 29 seem to be at risk, So what is it about this demography, this age range that endears them to drug abuse?
Now, you see, that age range is a very significant period where they transit from childhood to adulthood. Unfortunately for them, at that time, their brains are developing, and anything they take in tends to have more effects, positively or negatively. You see, from the statistics of the poll, 40% 15 to 18 years, you can see just 4 years in this bracket, you have 40%. Nigerians perceive that it is prevalent in about 40% of this age population. And from 19 to 29, about 11 years or so now, you have 48%. And I'm seeing 5% for 0 to 14. For me, I think this 5% is smaller. I mean, it's still small compared to what is obtainable. Really.
0 to 14?
Yeah. Because the person speaking to you right now started taking drug at the age of 11 years.
That's interesting.
Okay. And I have various clients, young people within this age range. As a matter of fact, what bettered our organization was the death of a young boy, 12 years, who had an overdose of tramadol. So we need to also consider that this age group, which is giving us 5% from this pool, maybe we need to do a more comprehensive research focusing on this age group. Now, what could be the cause for this particular age group is this. They are very inquisitive. They are very curious. They are in the experimental age. They want to try out everything. That is why I mentioned earlier that I'm careful with the kind of information I let out there in terms of naming particular drugs, because they are very curious. They want to try out everything on television. They easily affiliate, to some very wrong models. Wrong role models rather, on television, on the radio, and everywhere. Okay, so that is one of the reasons why these young people are quick to drug abuse. However, whatever causes or reasons we make up why people of this age group use drug, we must begin to identify, looking beyond these risk factors. That is not actually the causes of drug use. It is only a risk factor of the use in that particular age. With the causes, as I mentioned earlier, borders around their curiosity, their excessive energy. Okay, and then again, they lack certain skills. One of those skills is social skills. The second one is problem-solving skills. For example, maybe a young man comes to you and says, I hate disappointment. My elder brother promised to buy me an iPhone. I came back from my trip and he refused to buy me the iPhone. So I decided to take a particular drug. Or a young lady says, my parents are my triggers. They do this, they do that. And I said, okay, fine. There are many people who have the same kind of problematic parents, but never took the drug. Or you say it's peer pressure. I agree with you. At least not all the freshers in that university who were influenced by fellow peers took to drug. So why these particular ones, why are they the ones doing drug? Were they the only one exposed to the drug? There are people who have lived in the same room with a drug user for many years, 10, 20, all their lives, but they never indulged. So now, we need to begin to look beyond. So it is the ability for young people to solve skills, the competence that are not there. Okay, and then they are not able to communicate in terms of persuasion or in terms of, trying to negotiate with parents, with peers, and with other people.
Okay, now you said, all of those seem to be excuses why we take drugs. The findings also say that, at 33%, people feel that the causes of, abuse of drugs could be unemployment. At 26%, we have parental neglect, we have poverty at 17%, we have illiteracy and frustration at 13%. Could this be a reason also?
Well, like I said earlier, it's just excuses. The main reason is this: there are many unemployed Nigerians who are not doing drugs. And let me tell you too, we have top CEOs, governors of state. Hope they will not come and carry me after this program. Okay, we have top-notch, high-level.
Because they're the ones who can do the
yes, they're the ones that can afford the real expensive drugs. You see, do you understand now? So it's not really about unemployment. It's not really about parent neglect. How about someone who came into this life at the age of 5, one uncle called and said, "Come, I'm not really your father, your father died 5 years ago before you were giving birth to your mom died while he was trying to, in the labor room. And he was neglected." But that became a reason for this young person to struggle so hard and got scholarship all through his academic header and became successful. So the same reason somebody is saying, "Oh, because my parents neglected me." You even have parents to be seen, but they neglected you, but you are seeing them. Or somebody said they didn't provide it. Okay, somebody said, they gave me money, they normally pay my school fee, and after that, that's all. In fact, one told me my parents sent me to UK. Yes, they tried, but when I got to UK, he left me on my own to fend for myself. Like, what about those who don't even have parents? You see,
who doesn't even know where the airports are?
Exactly. Somebody just told me today that he doesn't know where the airport is actually.
Okay, I would like Nigerians to get involved in this conversation. We need to actually fashion out feasible ways of, curbing this menace that is destroying the lives of our younger population. So, do you have a child? Do you have a family member that's hooked on drugs? Do you know anyone who has successfully been rehabilitated? Because that's another conversation on its own. How do we win this war against drug abuse in our families, in our neighborhoods, in our communities? We're going to open the phone lines now. I would like to hear Nigerians share their experiences with us. The numbers to call are 0818 4270-287. I'll take that number again. We have a phone call, and let's see who we have here. We lost that. Please keep the calls coming. We'd like to hear from you. We want to have this conversation with Nigerians and not just in the studio. Hello.
Hello, good evening.
Hi, good evening.
Yeah.
What's your name and where are you calling from?
My name is Youthful. I'm calling in from Yanya.
All right, let's hear you very fast in 1 minute.
I want to agree with the A-House analyst that the reason or the causes for this drug abuse, some of them are the result of poverty. Because I've been opportune to talk to some of these little boys who have been into this, and some of them said, if I wake up in the morning and there is no food, if I take some pieces of tramadol or something, it may take me the whole day without asking for food. So you see that it is attributed to poverty. And I want the government wants to come in to make sure that some of these things are being curtailed. I would want to advise that there should be age brackets so who can accept either by science or by any means accepting some of these drugs. Because I discovered that even on the age, once you have your money, you can walk into any place and where they sell these things and buy them. So government should look at, be able to sanitize those who are into either medicine, patent medicines or pharmacies, and then make sure that they keep to a certain age bracket where you can come into a chemist or go into a pharmacy and be able to access some of this stuff. This is my contribution.
Thank you very much. Thank you very much. Dr. Ameze, I need you to respond to this because I think that people who do this really go through the back doors. I don't think it's the usual pharmacy that you and I work in.
Yeah, there's a black market for all of these medications, here and there. Agreeing with him, we had a conversation and we said, see, risk factors are different from causes. For example, you hear the doctor say that cigarette smoking is a risk factor. It's not a cause, it's a risk factor for lung cancer. The same thing goes, for example, early sexual initiation for young females is a risk factor for cervical cancer. Now, it doesn't mean that every young female who initiates sex before the age of 18, 17 will have cervical cancer. Now, but if you have the propensity, either genetically, one thing we didn't mention is the biological causes of drug abuse. The National Institute for Drug Abuse, which is the statutory body for drug control in the United States, have one of their goals in researching into the biological causes of drug abuse. And indeed, some genes have been discovered that are, when present, increase the propensity or the possibility of young people or people getting addicted to particular drugs.
Which means the person is not in control.
Exactly. Now, not in control is another key word for the definition of addiction. Okay, so the person, sometimes these people are not in control. Let me not delve into advocacy. Let me just answer that. So I'm not saying that poverty, unemployment, all of these social economic issues are not, do not affect the use of drug or the addiction to drug, but then they are risk factors. They are not necessarily the cause. If I can, be motivated enough to take my life in my hand and move on with life without parents' care or without parental care, or set up business on my own and move on. There are people who have set business up on their own, not waiting for government employment. Yeah.
All right. The phone lines are still open, and we are hoping that you'll keep the calls coming in. Like I said, the numbers again are 0818-4270-287 and 0818-4270-265. We want to hear what the situation is in your locality, how you have probably, if you've been involved in it, how you've dealt with it. If you have a child who's having to deal with issues like this, that's the conversation today. We're looking at drug abuse, substance abuse in Nigeria. Okay, now you seem to have debunked everything. You said, oh no, it's not poverty. Oh no, it's not, maybe not parental neglect. But then again, like you had said earlier, we have heard situations where bandits ask for, these substances as part of a ransom. Okay, so how does this, because when we look at the trend analysis from that poll finding, it shows that the highest figures from respondents from the Northeast and the Northwest at 47% and 44% respectively say unemployment is the major cause of drug and substance abuse. So we're wondering how insurgency and banditry in these regions have contributed to substance abuse. What is the link?
Of course, you see, these bandits, when they come into a particular community, they displace the hierarchy of activity and events. People cannot access their farms anymore. They take over people's farms, take over their livelihood, take over their homes. And in fact, we had instances where some insurgents took over a local government secretariat. So what happens to those who are working in that particular secretariat? So now, people are certainly going to lose their jobs. Companies may fold up. Some investors may leave those bandit-prone area. And so what happens to those who were working in those particular organizations? So they lose their jobs. So, and that brings us again to unemployment and lack of jobs. See, it is a risk factor and it is key because, like we said earlier, there are people who are employed, who are top CEOs, business owners, but are drug addicts. So what do you say is the cause for that person's drug use? In fact, one of the trigger of drug use is excess money. There are people who lack financial management skill, and any money in their hand, they are triggered to use it to buy drugs. So that is what we are saying, that these things are very important in as much as we try to adjust the space with respect to these risk factors that have been identified, which are true, but we must also look beyond and look at causes. Why this person who does not have job, why is he doing drug? Yes, he's got the job he doesn't have. Okay, why can't he think of learning a skill?
So let's say, okay, let's say for parents now, how do you identify a child that is hooked on drugs or that is on drugs already, and maybe it's still at the early stage, and I mean the signs probably are not too obvious. How do you identify them?
Very good. Now, we call that early signs of drug use. And this is key for parents, especially mothers, because they are the ones always in the house most of the times. Now, a child who has started using drug, there are certain things to notice early on. First thing, he may come home and start to withdraw from usual family gathering. This child normally comes to the house and probably sits in the parlor to watch movie, but now he's in his room. He avoids eye contact. Or you discover that he's not sleeping too much, or you check every time Junior is watching a movie, he's not sleeping, or he doesn't wake up early. Or you see him change friends, because most of the time, if Junior is a friend to Michael, and suddenly Michael does not agree to his new drug use behavior, he may stop going around with Michael and pick on James. Sorry if your name is James. Okay, so now you need to also know your children's friends to be able to pick this early sign. Another thing is he may be overeating or not even eating as much as before, depending on individual's biological makeup. Now, if it is such that it will make him eat so much, he will come and start finishing 2 plates and ask you, it's not enough. Now, if it is that he takes the drug makes him not to eat so much, you start finishing probably just half of the plates. You may also discover that the 20 naira or 100 naira give him as pocket money to school, he comes and says it's not enough, or money starts missing in the house. Okay, so maybe trying to make up for his new drug use behavior. So all of these things are early signs. Then there are certain things parents should also watch out for, because younger people are becoming so wise in terms of being innovative, getting high. Now you enter a room and you see certain things that should not be in the room. You see Maggie in your child's room, for example. You need to begin to wonder what's happening. What's he doing? Is he cooking with it in the room? No. Or you see him, he doesn't read newspaper, but funny enough, he starts carrying newspaper and put in his room, and you are sure he's not reading it. Old newspapers. Daddy say go and throw them away. He say no, let me keep them. You carry the rest and give to Mama Akara and keep the very old one that was packed underneath and keep in the room. What's he doing with it? You need to ask. Now you see him always with Coke. To ask, what's he doing with it? So I carried out research in 2019 October, in a secondary school here in Abuja, and I was surprised the kind of things these young people now do to get high. Again, we will not mention them. Okay, but these are the things that you need to, anything that you feel is slightly away from the norm, or should be with Junior, or it becomes suddenly very stubborn. So you need to begin to pick on these things. And you should pay surprise visits to your children in school. Just visit them surprisingly. I brought chocolate for you. It's just for you to know that he's in school.
All right. So now we've looked at the signs that parents should look out for. In case of addiction, what do we do to rehabilitate the victims? I'm glad that you run a rehabilitation center. We're going to talk extensively about your rehabilitation center later. But what is the first step when a parent notices that, okay, I have a child who has probably just started or is already hooked on drugs? What are the first steps? What do we do? Because I think most times a lot of parents freak out, and we're a very religious society, and the first place they go to is to the church, and they tell pastor, and pastor calls him and say, don't do that, you're a child of God. But that doesn't solve it. So what should we do?
Well, interestingly, Nigeria and Africa generally, we don't seem to be ready for what it is in terms of drug addiction and mental health, because we have a very traditional manner of stigmatizing and demonizing some of these behaviors. Unfortunately for a drug user or someone with problematic drug use behavior, it is not a behavior is in control of. That's the first thing and the first manner of approaching these things. That somebody uses drug or is hooked on drug, do not attend to that person with the perspective that he is doing it intentionally. Yes, the first time he took that particular drug, it was voluntary. He wanted to, he was coerced, he was whatever, but he voluntarily took that drug. But subsequent times that he's taking that drug, it is involuntary. He is under compulsion to use, even in the face or presence of negative consequences. So as a mother, the first thing is empathy. Not, you have disappointed me. Oh, what will my people say? Oh, what will the neighbors say? After all we have done for you. I know it's painful. Yes, you are disappointed, but you must know that this person now is having a disease, and that disease is a brain disease. It is called addiction. Okay, so you must first of all be empathetic towards this person and call him or her for a conversation. Hey, Junior, we understand what is going on. We feel for you, but you see, what can we do to help? Not beating the person. Beating him will not, or beating her will not help. Taking him, tell it to the world, let everybody come and be advising him, it may not help. But you see, a conversation with, how about taking him to the hospital? Do you see a reason to change? Sometimes they don't even see a reason to change. So through psychoeducation, either as an outpatient or as an inpatient, can make the person to convert from being pre-contemplatory to contemplatory, and then even decide to take action for change. So it is not enough to say, I love this person, and then call him in, beat him. No. Sit him down. Let him know that you feel what he feels. Don't feel, he's a bad guy. No, he's not a bad child. I have seen parents who tell their children, you are a bad child, you are a disappointment to the family. Nobody wants to be a disappointment to the family. Nobody wants to. So be empathetic, call them, have a conversation. Let's agree. Do you think you need to see a therapist? Where do we go from here? But for some people who are already hooked, they may not be able to do outpatient in terms of going to the home, come to the hospital and going back home and all of those. Maybe some support for inpatient treatment, after which he can continue as outpatient. In inpatient, he doesn't get the drug to use, and then he's being detoxified, and then he can be able to develop skills to resist drug resistant skills, and all of those.
How much of those kind of facilities do we have in, let's say, Abuja, for instance?
Well, we don't have so much of those facilities, and it's actually a challenge, because they are not available. At the same time, they are pretty expensive to afford. So it's a challenge really. But then I think in October last year, the NDLA, through the Director for Media, Babafemi Femi, had stated that the government will be citing 6 rehab centers in the 6 geopolitical zones, 1 each. So we hope that they are getting well with that project.
All right, so we're going to wrap up now, but I need you to, in 1 minute, talk about it. Okay, the poll is saying to reduce the incidences of drug and substance abuse, 41% of respondents say more jobs should be created. 30 say to create awareness on effects of drug abuse. Then there's also ban on sales of illegal drugs and all of that. So, for you, what should be the way forward to win the war against drug and substance abuse? In 1 minute.
That is perfectly correct. Let's create more jobs. Let's look at the areas of the risk factors, create more jobs, ban drug use. But remember, when the government banned codeine, people still get codeine. And some of the times, my problem with banning it's good to ban actually, because you truly see a decline in the use of those drugs. But sometimes again, it can create a bigger demand. You see people now, you rather it enriches the black marketers, because they will increase the price. If it was 7 naira, then when it was banned, it was about 7 naira, 4 naira per bottle. It rose to 4,000 naira, and people were still buying it. And of course, it can give you a ripple effect where people now who are truly addicted may steal and do other unimaginable things to get the money so as to secure the codeine. So let's still put those things in place, but awareness is key. And in drug fight or control, we have several segments. One of those is the drug demand reduction, which includes this awareness and other remote and non-remote pathways to it. So it's important that we begin to channel specific messages to specific audience, to mothers. That was why in 2020 we had a program, Women and Family Drug Addiction Program, with the Center for Women Development, to train them on these questions you were asking me about. How do you identify early signs, appropriate response, and how to aid coping strategies of recovering drug-using child. That was what the project was on. Okay, so such awareness campaigns are good. There are also lies told to young people. I have been in the program after speaking, a young boy asked me, I said, sir, they told me in school that marijuana is not addictive. It's if you take it too much or with other substances, you get addicted to it. I said, no, I had to debunk him and show him evidences. So these are the things that we need to do. Awareness, let people understand the effects of these drugs and how dangerous they are on their health and on the social space.
All right, it's been a very engaging conversation, but before we let you go, tell us about Vanguard Against Drug Abuse, that's the VGADA, and the VGADA Detox Center.
Well, Vanguard Against Drug Abuse is a non-governmental organization that was vetted in 2018, following deaths of 2 patients I had from drug use. And then one, Mr. George Leonard of Daily Trust, published our first article titled The Dark Face of Tramadol. And then that publication came with so many people who wanted to stop. Some even stopped and were having withdrawal symptoms. So I had to set up social media handles where they can reach me, where I can advise them. And then it has over time grown to become a registered organization. And just this year in February 4th rather, we commenced the Detox Center to also bridge in the gap for availability and affordability. Because before now, we've had to refer patients to other rehab centers, and these are quite exorbitant, up to the tune of 1.2 million naira monthly, 900,000 naira monthly. And then we felt, okay, can we also fill in the gap for these? And I think that's where we are now.
That's a very fantastic thing you're doing. Thank you so much for putting this up so that parents, so that people too who want to get out of this can also find a way to get out of it.
Thanks.
Okay, it's been a very engaging conversation. We've been interrogating the recently conducted drug and substance abuse poll. The full report is on www.NOIPolls.com. We've looked at the social impact of substance abuse on our youthful population and the interventions to help deal with this issue. And we have had Dr. Hope Omeza. He is CEO of VGADA Detox Center and the founder Vanguard Against Drug Abuse. Thank you for coming.
Thank you.
We'll drag you here again another time.
My pleasure.
All right. The future of our children, the future of your children, the future of the Nigerian child hangs in the balance unless we rid the society of illicit drugs and substances. If they are already victims, be sure to seek professional guidance. So, on behalf of the staff and management of NOIPolls, my production team, Jude Okafor, Dayo Omomomi, and Patricia Bassi, and of course Chooks, we want to say have a fantastic evening. It's a weekend already, so have a fantastic weekend also. I am Nelly Ohuche, Head Corporate Communications, NOIPolls. Good night.